Now, the average person is not healthy. So do you want your results to be compared to the average person? I don't.
Yeah.
So my doctor knows that I'm aiming for optimal health and vitality. So don't you dare look at my
Yes.
results and compare them to the average person and tell me I'm fine, because that's not okay.
And that's honestly a problem I deal with. The guidelines are if you come in with A, B, or C, I have to write you a prescription for 1, 2, or 3. And then if you have problems with any of those, I will write you another prescription for this. And it just, the realization of I was nothing more than a pill pusher was really brought to light when a patient called me his pill pusher.
Welcome to the Awakened Mama podcast. I'm your host, Crystal Rose, and today we are diving deep into the truth about real health, medicine, and healing. Are your labs actually lying to you? Dr. LisaMarie is a functional medicine nurse practitioner and founder of the LisaMarie NP educational platform. With over 30 years in healthcare, LisaMarie blends science, common sense, and soul to help powerhouse women reclaim their gut health, hormones, and metabolism without the guesswork or burnout. She holds a PhD in holistic nutrition and is on a mission to help women feel balanced, strong, and confident at any stage of life. If you love this kind of content, hit subscribe so you don't miss future episodes. Let's get into it.
Welcome, Dr. LisaMarie. Welcome to the Awakened Mama. I'm so excited to have you here, as you've got first-hand experience as a medical professional in the controversial topics that we're going to be speaking into today. I'd love to hear your journey of what took you from a woman in her 20s diagnosed with cancer to the woman who is now helping people heal naturally.
Thank you. I'm so happy to be here. This is going to be exciting. I was a very, very young nurse. I think it was my first year as a registered nurse. And I was diagnosed with metastatic thyroid cancer and misdiagnosed a few times, and then was given lots of really kind of bad information that I questioned from the beginning. And that's what made me personally start to look at alternative options, because I thought this just doesn't seem right. I mean, we found out I was pregnant the day after I got my cancer diagnosis. And I was told by 3 different anesthesiologists to terminate the pregnancy because the baby would never survive. And I'm happy to say that that's now my 32-year-old daughter who gave me 2 grandchildren. So I'm very glad I did not listen to them and questioned everything. And I think that really set me up, being my first year as a registered nurse. I think that really changed everything about me. I mean, talk about like a pivotal moment in my life. And I get a little teary when I think about this, because I actually, they didn't know, because my cancer was so rare that it rarely metastasized, this kind I had, but this one did. And because I was pregnant, they couldn't radiate me. I couldn't have radiation. So I was just so worried I was going to die and leave this baby. And I kept a journal for her whole first year of things I wanted her to know. Wow, this is crazy. You don't think about these things for years, and then you start thinking about them, and it brings back all the emotion.
Yeah.
So I think that changed how I was a nurse and cared for my patients. One of my first years as an RN, right after this surgery, I worked on an oncology unit. So, that kind of really hit home. So I think, I had a lot of insight from that point of view. So caring for my patients is a lot different. And then working in traditional medicine for all these years as a registered nurse and then a nurse practitioner, and just seeing how it changed. I mean, I've been a nurse more than half my life. It's been 35 years now. And things have just changed globally, very much so in the last 5+ years. We've gone from a system where healthcare providers were taught the art of medicine. There's an art to medicine. It's called a practice for a reason. And we've gotten to the point now that you can't practice within the traditional medicine system, at least in the United States. You cannot practice within that system without following the guidelines. And the guidelines are, if you come in with A, B, or C, I have to write you a prescription for 1, 2, or 3. And then if you have problems with any of those, I will write you another prescription for this. And it just, the realization of I was nothing more than a pill pusher was really brought to light when a patient called me his pill pusher. And, you don't have time in the system. You don't have time to teach lifestyle.
Mm.
And I think it's, so many people there, you've got a sect of people, patients, the population that just want a pill. So as a healthcare provider, you kind of get into that discontent of, oh, well, it doesn't matter. I'm not wasting my time to tell them to eat better because they want a pill anyway. They're not going to do it. And the flip side to that is that we're not taught how to eat right. Again, going back the old days, I was 1990, I graduated nursing school. And I had a nutrition class. That was it. We don't even have nutrition. They don't even teach nutrition in most programs anymore. Some of the programs are changing, but that's why when I started my practice last year, I left traditional medicine and just went all in functional and holistic medicine. And I really felt like I needed to do better and educate myself. So that's when I got a PhD in holistic nutrition.
I love that. When you mentioned the pill pusher, that's a lot of people. You're right. It is so normal for people because it's the mindset around the healthcare system or the pharmacology system,
Yes.
or sick care, whichever phrase that you want to use here. But people are used to, well, I go to the doctor and I get a pill and that'll fix everything. And I love Gary Brecker. He said, someone says they've been on an antidepressant for 18 years. And he says, and when did you think it was going to start working? Like, and
Yes.
people don't question that. It's just so normal to be like, yeah, I take medication and then I take another one. And so I would love to hear your experience during, let's call it COVID. It was an eye-opening experience for me. Like, I was fired for not having the jab. I was pregnant with twins. So I had to go through my appointments without my partner being there. All of the things that, you obviously want during that stress-free time that it's meant to be. So I'd love to hear firsthand from a medical professional, like, what that was like.
Well, I was very lucky because I was not in internal medicine. I don't think I could have gone through it, but I saw it from I think, a really worse scope. I was doing geriatric psychiatry in nursing homes in 3 states. So I was doing telehealth before we needed to do telehealth. And these poor people, the timing of it was so bad that in every nursing home once a year, there's always a flu epidemic, right? Because you're inside a very closed area, everyone's sharing the same infected air. Your people are going to get sick. So the nursing homes went from a flu epidemic to a lockdown. And that lockdown continued for the better part of 2 years. No visitors, no family. And it was chaos because, no one knew anything. Everyone was afraid. And in the nursing homes, I feel like I lost more patients from broken hearts than illness. Well, first of all, we're in nursing homes. These are immune suppressed people in a very high risk facility full of infections. And the only pleasure they had were family coming in, and that was taken away from them. And I had patients tell me that if I can't see my family, forget it. It's not worth living. It's horrible. And I have seen them. I mean, I saw them literally just lose it. I mean, standing in front of the windows, taking their clothes off, screaming at their family. They just, and these were totally normal people, just older. They were locked up, against their will. And they weren't even going outside for over a year. No one could go outside. It was just, that didn't make any sense. So that's what I saw. That's what I was working with. But personally, I really just, I'm a big researcher, and I'm the person that doesn't believe the studies. You know what I mean? I need to see the study. So, and that probably comes, I did research at the very beginning of my career for a drug approval. And that probably just made me, dig deep into all the research. And what I like to do is look at a good chunk of the research, see how big was the cohort, what kind of study was it, and look at, kind of throw out the outliers and take everything with a grain of salt, because I feel that you can find research that supports anything that you're trying to support. And this is where your common sense and education comes in, because you have to sort through it, look who sponsored it, and follow the science. And so many of these, where they got things, just didn't make sense to me. And I thought, oh my gosh, where'd we get that? And I felt like I missed something, or something changed. And I was like, how did we come to that? And that kind of is opposite of what I thought. The arbitrary, like, why can't we go outside? That would make sense if that's the safest place. Because I know here in Ohio, in the United States, they close the golf courses.
The fresh air and the sunshine, you don't want that.
Exactly. So it kind of didn't make any sense. And then, the shots, and that's a whole other issue. And it was like, okay, well, where are the studies? What's going to happen? And I literally said to my husband, it'll be 10 years until we have any idea what is going on. And again, the scary thing is that, if you said anything against it, if you said anything, you were sanctioned or at risk for losing your license. And, there's a part of me that still thinks, okay, well, someone's going to complain about me thinking, food as medicine is craziness, and I shouldn't be thinking that, and I shouldn't be sharing that opinion with anybody. So I don't doubt that someday someone's going to put a complaint in against me. But, the first thing we do as medical professionals is take an oath to do no harm. And I guess everyone has a different level of what harm is, but eating the garbage processed nonsense that is being even touted as healthy, one of the things I do is, I put together, I have a group program now, but in my practice, I realized very quickly that people don't know. There's so much, and I don't know what you want to call it. I don't want to call it, it's more marketing than anything. You've got big food, big pharma, anybody who's trying to make their money. And you look at a package, like the whole gluten-free craze. Everyone's like, oh, I'm going gluten-free. Okay, well, read those labels, and it's still a whole bunch of highly processed carbs, and all carbs turn into sugar. So, that's, and it's a lot of teaching, and you have to do a lot of stuff, because I love the saying, a little knowledge is dangerous. And before AI was around, we used to laugh and say, oh, Dr. Google. And I would say, please don't go to Dr. Google, because you get one little snippet out of context, and what might be good for one person isn't necessarily good for you. So, but people will take this little nugget that was shared by an influencer or someone, and that's the be all end all. And so I do a lot of unteaching in my practice. But so that was my biggest issue with COVID, because one, I saw it from the patient's point of view and the family point of view, and the sadness and the heartbreak of these poor people. I mean, were prisoners. And then at the time, at least here, we had riots happening in the States. Well, remember, you've got a bunch of old people who have Alzheimer's and dementia, and every TV is on in the facility, and they're laying in their bed with nothing to do. They're not allowed out of their room, and they're hearing the staff and everybody in the news talk about riots. Well, it's taking them back to like the 60s, when they lived through riots. So there was a lot of acting out and a lot of things that a little bit of air and sunshine could have helped. But so that was, professionally what I was dealing with. And then personally, just the second guessing of everything that made sense in my head, and everything that we were being told, and everything, like, it didn't make sense. Like, again, I work telehealth and we were mandated. Actually, my company, the day before they were going to enforce the mandate, because we were paid with government funds, we had to be vaccinated to work. And I never went into a building. I never went into a building. That didn't make any sense to me. Like, who, But so it was just a whole bunch of nonsense on top of nonsense on top of, well, this sounds good. And it scared the bejeebers out of most people. And early on, everybody was scared. Nobody knew what to do, so it was just a bad.
Well, people were scared that if you didn't get it, then you were putting them at risk, even though they got the jab. So they were protecting themselves, they thought, but you were putting them at risk by not. So there was a lot of people that were just so worried that, I mean, they were believing what they were being told. And I suppose that the system sort of brought them to this natural process. It was natural for people to follow the system, I suppose, or whatever. That doctors
Mm-hmm.
doctors wouldn't lie to you. The government wouldn't lie to you. Like, I heard that so many times.
Yes.
Okay. It's an experimental drug. What don't you get about that? You don't know what you're putting into your body.
Yes. Yes. And I saw, I saw I had some younger 50-ish people in the nursing home who ended up having a reaction. And the first time I saw a diagnosis that they tied to a side effect, I was shocked that I saw it in the medical record. But and I mean, everything has risks, and I always believed that it was my duty, and nurses, again, we were always taught the difference between a physician and a nurse, or a nurse practitioner, is nurses were always taught more of a holistic approach, because as an RN, we don't prescribe, we don't diagnose, but we did a lot more non-medical or non-pharmaceutical things. So fast forward, that's why most nurse practitioners, if you've been doing this for a while, we will start with something lifestyle based before a prescription, just because that's in our training. That's kind of in our nature as a nurse. And so it's a little bit different, but it just is so hard to go back to think about how things just, you follow the lead. And we used to teach people to make the best decision. And I say to people, you can have 5 people who have the same diagnosis, and I can say, here are the options. These are the pros and cons of each of them. Everyone might make a different decision, and that's the decision that's best for them at that time. I had, at the age of 23, I had 3 different options. Well, actually, a few more, but different treatment options. And based on my situation and, what was going on with me at that time, I chose, something a little more aggressive than I would have maybe if I wasn't pregnant, or if my circumstances were a little bit different. It doesn't make it right or wrong, but I feel that our job as healthcare providers is to explain the pros and cons, and as patients, it's our right to say, okay, this is the one I'm going to do, and we need to respect that. And that is what has been erased from our ability, because now if you don't, there are a lot of practices here that as a patient, if I go in with a cholesterol above 200 and I don't take the statin you want to give me, then I'm dismissed from the practice, and I don't have a medical provider I can go to, which that shouldn't be. I thought, we should support people's decisions. And granted, some of them aren't the best, but that's still, it's free choice. We all should have free choice.
Absolutely.
So that's my struggle with where we are in traditional medicine.
You mentioned you love following the science and the research. Since starting my health journey 7.5 years ago, just have fallen in love with the science and have become a bit of a health geek like that. Like, I love looking at, well, is there evidence? Is there science to back this? And recently I saw something about the flu shot, because you mentioned that. And have you seen the latest evidence to say it's not
I
so good after all?
Oh, well, I will be honest with you. I I had a flu shot one time when I was in grad school in my 40s, when I had to get it. And it, now I know it doesn't make you sick. It's not supposed to make you sick, but just ironically, it was the sickest I had ever been. A winter I was for a month. It was horrific. But, maybe it was a coincidence, but since that time, I think the year I took the flu shot, which was about 12 years ago, that year it was 60% effective. And that was one of the highest years that it was effective. And it just didn't make sense to me. In my situation, I thought, okay, well, the juice has to be worth the squeeze, right? So if that goes back to what I said, that you need to lay out all the options and say, well, okay, well, so if I get the flu, I'll be okay. My immunity's okay. I'll support myself. Am I really gonna take this in hopes that I got a 50-50 chance of not getting sick? Well, there's so many other things out there, colds, flu, viruses, you name it. Chances are you're going to get something, a sniffle or something. We can't live in a bubble. And again, I remember taking my kids to every kid in the neighborhood who had chicken pox when they were young, because I wanted them to have natural immunity, because we were always taught natural immunity far surpasses artificial immunity.
Yeah, it was such a thing when I grew up. Everyone had like the measles or chickenpox parties because, well, you've got it. Let's all take our kids to go get it over and done with now. Like,
Yes.
you get it, you're
And
good.
now I think, and again, I think everything starts out with good intentions, but kind of like the swing of a pendulum. We get to the sweet spot, and then it gets ruined by many different factors, whatever it might be. And then it goes and turns into something bad. And I think that's where we are with a lot of medications and a lot of the pharmaceutical industry. I feel that, in most cases, most vaccines are good. The originals that were tested for a long time, But now we've got all kinds of preservatives in them and we're putting more garbage in them. And it's just, and now, and the I'm sorry, the table of pediatric vaccinations that are mandated for these kids to get nowadays is 5 times what it used to be. And it's like, okay, I mean, are we doing more harm than good? Are we
Yeah.
overloading this little tiny, not even fully developed immune system? Again, but so I don't think, to your point about the flu shots, I did not see any of the new research, but I just know that the old research really, it was like, 50-50.
I've dug heavily deep
I'd
into
love to
this
hear.
hole with the vaccines, and I my older 3 children had the childhood immunizations, and we have a list of diagnoses: autism, ADHD, OCD, ADD. Um, hang on, ODD, or ADHD. Anyway, there's a bunch of them, right?
Yeah,
Eczema. Uh, the more I dug into this, the more it is very clear to me the rise in autism. I mean, you can ask anyone at school now. There's like 1 in 10 people. When I grew up, we did not know random children with autism.
yes.
So my twins are not vaccinated. They are so healthy. I don't see how a baby, when they are born and they're a newborn, they need to be injected with a vaccination for Hep B, because, as far as I know, they're not having sex and or doing intravenous drugs. So, like, healthcare system, please explain why we are jabbing the babies with that. Like, this is the kind of thing that I think more women need to know about, because you just think it's normal to follow the protocols
Yes, I agree.
and not look into, like, there's just so many babies now that are having their vaccinations and they're changing, they're losing their speech, head banging, like there's just a lot going on. And I think that, yeah, more eye-opening, more discussions, all of that, it needs to be had so that people can make a decision, but it can be an informed decision.
Exactly. And that's my whole point. And we were always taught it's no judgment.
Yeah.
You
Yeah.
I don't care what my feelings are about anything or anyone, but if I'm working in the prison system and I've, got a hardened criminal, I'm going to take care of them exactly like I would anybody else. So it comes back to now, how did the choice of, because again, when people made the decision not to have their children vaccinated, okay, that's your decision. Here are some risks that, for not immunizing, but then you have on the other side risks for immunizing. And to your point, the autism rate, so many rates. You look at the diagnoses of so many things. They did not exist. And the numbers for things that did exist have risen exponentially.
Yeah, you look
I
at the
think,
charts and the vaccine schedule, as they increase, so do all of the, it's crazy.
well, and not even that, just you look at the whole macroscopic view of the healthcare system, the number of medications that people are taking,
Mm,
the food industry,
yeah.
how our food nutrition has gone down because of additives, agriculture, and the US, our food's horrible. It is, you know,
Glyphosate, all of the things that shouldn't be in food,
yes,
carcinogens in baby food. Tell me
yes.
why.
Well, simple, and this was mind blowing. Huge. Did a lot of research on glyphosate, gluten, and grains and agriculture in my PhD program, and it was the old. I don't even want to say old, but what they now call ancient grains, like from the 50s and 60s, like what I grew up on. There were 500 protein strains in it. There are now over 1,200. in what, they call Frankenwheat, because it's the GMO and the glyphosate treated that our guts cannot break that down. It went from something simple and healthy. Now we take out all the healthy stuff, add all kinds of garbage to it, and it's just so much more difficult for our gut to break down. So you add that, it's just like another straw on the camel's back, another straw on the camel's back. That's why everyone's getting broken, because this toxic load that we're carrying is from day one, from everything that's being injected or put into the body. And again, you live and learn. Because I had to have radiation, I did not breastfeed. I only breastfed my daughter for a few weeks because I had to have radiation. So of course I was like, oh, well, she turned out fine. My son will be fine too. Well, now you look at if you look at the ingredient label of infant formula, it's horrific. It's
Yeah.
horrific.
Yep.
So
I breastfed the twins for 2.5 years because I was like, F no. Like just
exactly. And I think, and I don't want to say it's a generational thing, but it is. And I think maybe my
yeah.
generation, we have one foot in the, we did everything. We didn't do fast food. But even if you did once in a while, it was totally different food than it is
Oh,
now.
100%. People don't get that. Yeah, I might have eaten Macca's on the odd occasion, like, or something like that. I grew up healthy and we didn't really have a lot of that. But still, when we did, it wasn't the same as what people are eating now. There's so many more ingredients in one chip. It's just,
Exactly.
well, I'll tell you what's not in there. It's potato.
Exactly. And that's, I'll make potato chips if we have all the kids come over, if we have a family dinner. And it's like they're getting a treat. Everyone is so excited when I make homemade chips. And it's like, okay, I have organic potatoes and a fryer full of beef tallow, organic beef tallow. There you go. That's all that's in it. Delicious,
Yep.
little mineral salt. Um, and yeah, it's a splurge, but it's better than anything else.
And it's a vegetable and they're healthy fats. Like these things, we can still consume them and we don't have to feel guilty. We're allowed to have these kinds of things. And there's such a better option than the easy option of the other. Because is it easy? Because is it easy that to then have those toxins in you and build up? And I think that a lot of people will look at it and go, oh, well, I'm fine. And other people have all of these like autoimmune and what I think people don't realize is how well your body can detox things. Like, do you have
Yes.
the MTHFR gene like I do? That I think that that's how people kind of get suckered into like, oh, well, I'm fine. Like I eat it and I'm fine. You might be fine for longer or not fine, but building it, whatever is possibly coming, like the unhealth that's
Yes.
coming.
Yes. And so here, three things just popped into my head. First, the MTHFR gene. I just need to mention something about that because, everybody's like, oh, okay, 60% of the population has that. So you just assume you have it. And the one easy fix is the B vitamins, a methylated B supplement. Easy. What is not being talked about and what not many people realize is folic acid is
Yeah.
toxic. It is synthetic folate and it is everywhere. It is
Yeah.
everywhere. So if
Enriched with. That's what you've got to look out for. Anything that's
exactly,
enriched with.
exactly. And like that's the first thing I tell my patients when we start cleaning things up, because that it just acts as a toxin. Your body can't process it, so it hangs out there, contributing to your chronic inflammation. And I tell people that, chronic inflammation is not something, it's chronic. So it's not something that one morning you wake up and think something happened. It's a slow, steady build. And of course, the older you get, if you're not, everything builds up. It's all an additive effect. And this is where when we talked about the incidence of so many different things, diagnoses and surges of things happening, autoimmune diseases. I want to say 10 years ago, if you look at the ICD, back then it was like 8 or 9, the code book that we diagnosed patients with, there were not as many autoimmune diagnoses as there are now. And when people come to me and with their list of diagnoses, like, they're all autoimmune. It doesn't matter what you call them, the treatment's the same. And it amazes them, and still kind of amazes me, because the body is the most amazing thing to me at all. And all it wants is balance, and it just wants to protect you. So all of these symptoms that you start to feel are little red flags that your body's saying, hey, pay attention to me. And the chronic inflammation is kind of like I say it's a cauldron. Your gut is the cauldron, and the inflammation is the flame. So the more toxins you add to it, the higher that flame goes. And eventually you get all of the autoimmune diagnoses. And then I say, it's kind of like you're driving your car off a cliff. How much room do you have before you get to that cliff? If you wait a really long time, then yes, you can feel better. We might not be able to get rid of all of the symptoms. But if you start early enough, the better your chances are. So when you recognize that, recently I had a patient come to me, and again, with a list of, I've been diagnosed with this, and now they think I have Sjogren's, which is another autoimmune disease. Gives me her list of symptoms. Okay, we start where we always start, getting rid of the inflammatory foods. And her vice was Diet Coke. And she drank about 3 or 4 a day. She would start with one in the morning when she was in bed. And I say to people, the good news is that that's one big thing that if you stop will make you feel better really quickly. But the bad news is you need to stop it. So she did. Within 2 weeks, she had been gotten off of all of it. That quickly, things started to reverse. All her issues, the bloating, the fatigue, the pain, the constant pain that she was in 2 weeks. So it amazes people that just one little change can, and it makes you believe things. It's like, okay, so what else am I poisoning myself with? What else do I need to get rid of? Because I want to keep feeling this way.
100%. I can relate to that because, like I shared with you, I started my health journey 7.5 years ago, and I started with nutrition support. Although I thought I was healthy, I didn't think I needed it. That was me. I was like everyone else and thought, no, don't need this, but my family does, so I'll be a role model because, I'm a mum, and so that's what we do. And so within the first week, I had energy and I was sleeping better. I accidentally quit caffeine, which I was like 3 a day to get through my day. And so from there, we spoke about how health becomes a rabbit hole. And so, like, I was using our health programs. So with our nutrition support, we get holistic health programs, and they come free with it. And so I started using that, and I was improving my eating. And the Naked program that I use is about like stripping things back to whole foods and stuff. And so that was kind of the cascade there. I was like, I'm supplementing now, and I'm eating better, even though I thought I ate good before. I'm eating better. And even though I was doing those things, I already had years and years of toxins building up in my system. Now, I have cancer in my genetics. I've lost 2 people to cancer in my family. Since doing my health journey, I have done extensive tests, And so it's confirmed that it's in my DNA, like it wasn't a surprise. But I also have autoimmune in my genes. Now, the markers are there, but I wasn't experiencing or having been diagnosed with autoimmune. However, I did get a lot of hip pain. Now, hip pain has run in the women in my family since I I was 15, and I was the youngest to have gotten it that early. And so since 15, I've had that. But then I started getting back pain. And so I was diagnosed with genetic scoliosis. And then I was further testing. I was like, it doesn't make sense, because they said where I was getting hip pain and lower back pain, it shouldn't have been my scoliosis. And so turns out I have a bulging disc in my L5 as well. And so, like, I knew what chronic pain was because I was experiencing that. um, and I started looking more and more like we took seed oils out. Like, it was obviously I'm not drinking tap water, all of the things. It was just continue to do more and more things. And we bought, I did the most powerful thing that I did, honestly, was a combination of things all at once. And it was a parasite cleanse, a high protein detox from our new program, and what did I do? The parasites, the high protein detox, and something else. I did three things all at the same time, and that was actually, I will share, painful.
I was going to say,
toxins moving through me. I could feel, and I was like, this isn't right. Like, I can feel the toxins moving through me. The 3 days of them moving through my body and then passing heavy metals and parasites, like, just, I felt so much better. Now I don't get the pain that I used to before, now that I don't have those. And so while, yes, we can have diagnosis or we can have things in our genetics, we can still eliminate the chronic pain, the inflammation. Now, the capsules that I take are they're whole foods. So I believe that, well, I know we don't get the nutrition that we need from foods these days. It's not in the soil. It's
Nope.
nutritionally depleted. And so we have a different approach with supplements. I started with my supplements, and I will never stop taking them. And I will always do it to bridge the gap, because I believe we don't get what we need from food. And it's just they're fruits, they're veggies, they're berries, they're omegas, they're all plant-based. And I know how they feel in my body. But I've also done lab testing, and I can see in my labs and in my what I use, how obviously it was going to be so good for my body, just on top of bridging the gap. But my body actually needs the berries for the inflammation, and like the different things like the MTHFR gene, and like helping with the detoxing the liver, like everything that I have used and done has, it all makes sense now, having a look at the lab breakdown and stuff like that. And the program, like everything that I've done has been a natural approach, because I entered perimenopause last year. That was fun.
yeah.
And I'm so lucky, because not to have entered it, yay, but my mentor who created these programs, she's entered perimenopause the same year that I did. And so she's created this program, and it's backed by science and like evidence-based, all of that sort of stuff. So I was able to balance my hormones naturally, so that this roller coaster can be a little less loopy. And it's just nice to have her in my back pocket, basically. Like, she follows the protocols. And so I love that, even though we have a different system with supplements, we do have very similar ways of, like, natural ways and supporting hormones. So I love that you do that with women, because I know how much it has changed my life. And I can see that
Yes.
I could have been if I wasn't healthy, or if I didn't change the course of my life with the things that I did with, detoxing and coffee enemas, parasite cleansing. That was the other thing I forgot. Yeah, that's a whole nother kettle of fish. I won't even open that can of worms, but literally. But anyway, I know where my future would have headed, and it wouldn't have been good. And I don't want my family to have to take care of me because I am dying of a disease. I know what it is like to lose a loved one, and so
Mm-hmm.
if for everyone who is wondering how you help women with the program that you've created, can you share what it is that you do and your process with your labs?
Sure. I found in my practice that, and again, I started with hormones because that was my second deep dive into that rabbit hole in my late 30s. And I had just lost my dad. So it was an emotional time for me. But I knew this was a hormone issue because my symptoms were very cyclical. And, it was like a roller coaster. And I went from feeling okay to I could literally crawl into a ball and don't talk to me, don't touch me. I'm going to cry, or I'm going to kill you. Take your chances, one or the other. And I was like, okay, I have a short amount of time to get this straight because it's going to happen again. And I went to my gynecologist. Oh, here, your dad just died. Here's an antidepressant. I'm like, no, I don't need that. It's hormonal. Went to my PCP. No, it's okay. You're just stressed. And no one wanted to help me. So went down that rabbit hole, started, found a hormone specialist, and like night and day. But to your point, I don't think it's necessary. Well, everybody's different. And to have options, whether you're using like a bioidentical hormone replacement or whole foods, you have lots of options and your hormones can be balanced. So I started wanting to do that, but realized, especially when I was getting women in menopause, not just perimenopause, who who had no hormones in their body, then rather than starting with the hormones, because I found that you can't have balanced hormones if your gut is out of balance. You can't maintain any kind of weight loss if your gut's out of balance. And so it's kind of like, I say it's like a three-legged stool. If one of the legs is off, you are face planting on the floor. So I say I'm that person in the basement rebuilding your foundation, fixing up your gut, and then everything else falls into line. So that's basically has been my process working with my one-on-one practice. And I've broken it up into an educational component. And because a lot of people don't want the whole big deep dive, aren't quite ready for the whole intense 5-month one-on-one program. So I've broken it up into my first program is launching, and we focus on the basics, cleaning up the eating, getting the gut in order, and then kind of touching each component, hormones and weight loss, throughout the process. But if you don't have that foundation, like detoxing, and it can't be, there's no quick fix. This has to be small changes that you do consistently. And I'm sure your journey has been a few years. Mine has been, many years. And, it just, every change takes you to the next step of feeling better. You get to be, my age now. I don't think I'm that old, but I just turned 58. And, I look around and there's so many people who aren't enjoying life at this age, and you should be, for many reasons. I mean, and again, this is a whole other topic, but and if you're not feeling good, if you don't feel good in your own body, I have people coming to me that they can't leave the house because their mood, they don't want to, mentally, physically, their gut, it's so unpredictable. They're not leaving the house. So once you clear everything out and your gut is absorbing nutrients like it should, because you can supplement all day long with the best supplements. But if your gut is so messed up that it's not absorbing anything, forget it. So you've got to clear that out, clear the liver out, because that's your powerhouse in your body. And those are constant things. So one detox a year, yeah, not working. You kind of need to have a program. And I agree with you that supplements, they fill the gaps. And there are some that I will be taking all the time because, they're so important and you need them. And then there are others that I use intermittently, to make sure the gut stays in balance. There are no parasites sneaking up on you, because there's no downside to a natural approach. No one's going to die from eating healthy. No one's going to get sick from eating healthy. If you have if you do a parasite cleanse or a detox a few times a year, that, in my opinion, keeps everything on point. And then you don't have the backup to say, oh, now I really feel bad. It's all about prevention and maintenance.
Yeah, I like that. I think that people get a little stuck in how they've been for so long and they don't see a way out of the pharmacology system, being trapped
Mm-hmm.
in taking one script after another. And like, I know because I've spoken to people and they're like, yeah, but you don't get it. Like I'm in so much pain. And yeah, I'm like, no, I get it. Let's look at healthy options. Let's look at getting the toxins out of your body. And yeah, 100% once a year isn't enough because we're surrounded by toxins. It's in the air, it's in your water, like it's everywhere. You can't escape. So yeah, doing
Exactly.
regular detoxes. And what I love is when I was breastfeeding, and one of our programs has a 10-day detox, and I couldn't do it because I was breastfeeding, and I was really looking forward to it. And then because I follow our Sculpt program that's got for hormones, and
Mm-hmm.
it is a um, high protein program, and so then Kira created the high protein detox. What I love is that it's done in sync with your cycle. So because a lot of women don't realize is that you shouldn't be doing things like fasting and that sort of thing, or detoxes in certain parts of your cycle. And because we crave more carbs and chocolate and things like that, because our body
Good
needs
reason.
more calories. And that's
Yes.
that week before our periods due, where our hormones are dropping. And we really need to honor our bodies. And when we're fresh in our spring cycle and we're feeling optimal, our hormones are good, then we're ready to do things like detoxes and fasts. And that, when you're doing it correctly and you've got someone like yourself who can guide you to do these things,
Yes.
then you can get better results. I think that what women, or maybe men too, but men have a different cycle, so it's just it's different for them.
Exactly.
So much easier to have a 24-hour cycle. Anyway,
Mhm.
but I think that they'll try things because they hear it's a trend, like intermittent fasting. Like it is such a trend to do intermittent fasting. But what they don't realize, it's a stressor on your body. And so if you're not doing it right, of course your body isn't going to have the results that you need, and you can cause lots of issues like adrenal fatigue. Like you need to do things the right way. And this is where research comes in. Look at
Yeah.
what you're doing. Is it backed by the evidence that this is what's good for you?
Yes. And then what are you going to do with it? So like I have people who will say, because now of course you can get lab tests anywhere, okay? But what do you do with them? That's great. But what do you do with them? And I have people who have come to me who are like, oh, well, I ordered this through this and everything looked okay. Well, it's because you don't know what you're looking at, and then I look at them and I'm like, well, this is why you're not losing weight. This is why you're not sleeping. This is why this. Oh, okay. Well, I can do that myself. Well, clearly you can't. Clearly you can't.
Right?
Like you said, I mean, intermittent fasting, good on paper and perhaps good for a lot of people, but not all the time. And you have to understand, and I'm a big why person. And I used to teach at a local nursing school, and I used to tell my students all the time, think about why. Why is the patient looking like this? Why is this happening? Like, if you figure out the why, it all starts to make sense. So so yes, intermittent fasting works very well, but what else is it doing? Why are you using it? And is it right for you? Same with supplements. I have people come to me with sometimes 30, 40 different supplements. And, you know, if you're not absorbing them or if they're crap, they're not doing anything. So there's a lot of finesse involved with everything you and I do, and knowing, it's never one size fits all. So that's what I do a lot of. Like, we decipher, you look at labs, and I go where the labs follow. So I do labs in all of my programs, and even in the group program I'm launching, I have a lab panel that I created just to give me an overall look into inflammation, your gut, your metabolics, and your hormones. And then, I teach you why you want these numbers, because, you know, it's really, it's not that you all of a sudden you're healthy and then, oh my gosh, you have a disease. No, that builds up over years. So
Exactly.
let's find it years before. The sooner you find it, the easier it is to correct and get you on the right path. Don't wait until your traditional doctor says, oh, I have to give you a prescription now because you have diabetes. That was brewing 15 years ago.
You mentioned absorbing people taking supplements and their body not absorbing them. Now, I think that it's important for people to know what sort of supplements to take too, because so many people are just taking multivitamins off the shelf and they're synthetic. So, of course, your body's not absorbing them like a real food because
Mm-hmm.
they're not real vitamins that you
Mm-hmm.
get from. And that's what I love. Like, check, are they bioavailable? Like, that's why I love what I did. They heal on a cellular level, because with the lab testing, I was so excited to see that I did the biological age test and saw that I'd reversed my cellular age by a decade, because they heal, they work on a cellular level. And that's the difference between a multivitamin from Coles or Woolies or whatever supermarket that you
CVS.
have,
Yep.
and real food, because you can't compare a synthetic to something. And so, just, I think, another way that people have to do their research, just look at what you're putting in your body, because
Yes.
like you said, you can't absorb that. Are you just going to disco wee that out, like, and why don't you just throw your money down the drain?
Well, exactly. And it's not even necessarily that you're going to weed that out.
Oh,
You're stressing your body
yeah.
trying to break it down. And in the case of folic acid, if it's a non-food or non-nutrient substance, it's going to build up like a toxin in your body, and then your liver is going to have to do the hard work to get rid of it. So you're just stressing your body out if you're not able to absorb it. So,
Yeah.
and you're just wasting your money. So and again, I have I use a couple different lines of supplements, and that's based on, I have one that's a liquid, it's highly absorbable, and it depends on the person, because you want it to work for someone. And the food-based supplements are so easy to absorb because your body recognizes it. It's like, okay, I'll take it. Thank you.
I think that not enough people look at what their bodies need, either nutritionally when they're eating and they're not mindfully eating, and it's just all a hamster wheel. Basically,
Yeah.
life is just a hamster wheel. Just wake up, eat, and it's just, I wonder why I feel this way. Yeah.
Yes. And it's, cravings they tell you something. You
Yeah.
know,
Yep.
if there's something called pica, and that's when you crave a non-food substance. And it's common in pregnancy. But it also, and working in psych, I had several patients who, the staff would want me to medicate them because they were eating, paint chips off the wall or newspaper or something. Like, well, let's do some testing on them. They're probably nutrient deficient in something. Their body needs something, and they're trying to get it. So it's just like, when you crave a lot of carbs, when you crave sugar, it's a lot of that is gut dysbiosis and gut imbalance, because the bad bacteria love sugar.
Yeah.
So that's, and
So do
it,
the
again,
parasites.
ex- exactly.
Yeah.
And
And if
it's
you're
amazing.
hungry after 7 p.m., you're feeding the parasites because that's when they're waking up.
And it amazes me that I have seen so many parasites and I see them in low platelets in people's normal blood work. And it shocks me that I'm like, what did your provider tell you about this blood work? Because it's usually blood work that they send me, not the one I'm getting. And they're like, oh, they said everything was fine. I'm like, okay, you got something going on here.
I find
It's
it
just,
disgusting. That's how I feel about it. Like, it's honestly that these sorts of things are not openly just checked, looked at by doctors, that they they cause so many of our health issues.
yes. And no one understands it. And I appreciate the ones who at least appreciate the work I do, because I'll hear it. One of my patients who was just horrifically sick. And the lab work she brought to me was scary. And I was like, oh, wow, like what are we going to do? And probably within the first 6 months, she took the lab work I did to her PCP, and he said, I have no idea what she's doing. I don't understand anything that's going on, but I have never seen your blood work look this good. Because, no one goes down to the cellular level. I mean, we're literally, your body is made up, we're a cell. We're a whole bunch of cells put together. So if you have a disease of chronic inflammation, that's because your cells are inflamed and sick. And those individual cells combine to make your tissue. And then we have, just, I'm a very visual person. So you imagine a little teeny tiny cell just super inflated, like a giant 18-wheeler tire, and you're going to be a bundle of inflammation. And you step out of bed and you're going to say, oh, that hurts. It's just so, and you don't think about it in that sense, because it's not so, it's again a slow burn. It builds up.
Yeah.
You don't wake up one day feeling horrific. It's a slow, like one day just builds on another and builds on another. And no one, like traditional medicine, just has no idea, because there's no pill to fix it. And that's where everyone gets stuck. And I mean, what I do, I'm spending at least 2 hours with for each patient visit. And that's not counting all the other work. But, it's like we're constantly looking at everything, because everything is connected. You
Yeah.
know, the athlete's foot that, the athlete's foot that you don't think is anything, you think it's incidental, but you can't leave the house because you don't know where the bathroom is. They're all connected. That's a yeast overgrowth. That's something. So, everything's too siloed in traditional medicine. Like, oh, go to the ear, nose, and throat doctor because there you go to the GI doctor, and no one knows what anyone else is doing, and no one ties it all together. So I said, I feel like the investigator, from like a cold case where you have all those pins and you tie everything together. That's pretty much what I end up doing.
I love that. I love, because like you said, you spend hours looking at these tests. I
Mm-hmm.
know how hard they are to read. Like I got the Dutch hormone test because I was unsure if I'm in perimenopause or whether it was because I was postpartum, still breastfeeding twins.
Mm-hmm.
Honestly, probably a combination of both, but it was definitely perimenopause. And
Mm-hmm.
the Dutch hormone test confirmed that. But like, I took those results to my doctor, even though I got that test online myself. I wanted to make sure that she helped me read it because I
Oh yeah.
don't even know. And I had to book double appointments and a few of them to go through, and we're still not done. I'm getting another round of tests to then see for the DNA comprehensive health test. Now it shows everything that's in my genetics, and then what I should be having, and that's what, like I said, I love looking at what I'm using, how beneficial it's been for me, and I'm like, I'm
Yes.
onto it. Look, I'm doing that. But it's looking at, well, where's the missing gap? And I started magnesium since having
My
perimenopause
favorite.
symptoms. Yeah. And there's so many different types of magnesium, but anyway. But like, it's just so important to get a professional to help with this sort of stuff. And I mean, my doctor is great with looking at a natural approach. And
Mm-hmm.
when you said um, my results are fine, and that's people's responses, I just want to go there because we're being compared to the average person. Now, the average person is not healthy. So, do you want your results to be compared to the average person? I don't.
Yeah.
So, my doctor knows that I'm aiming for optimal health and vitality. So, don't you dare look at my
Yes.
results and compare them to the average person and tell me I'm fine, because that's not okay.
And that's honestly a problem I deal with because people, will either bring me their lab work or when I start to review their lab work and they're like, well, it's not red. Nothing's red. Well, I'm not looking at a disease. Red is telling me that it's really bad. We want to be optimal. So I am looking, my levels, my normal levels that I look at are much, much lower than what your traditional provider is looking at. So there's so much to that, and I just want to mention the tests. Like I have at least 60 hours in classes of how to interpret and treatment plan for the Dutch test. So all of these deep dive functional medicine tests, I have hours and hours into training how to do them. And my genetic test, the same, about a 40 to 60 hour intensive boot camp. And then I have a year long membership that I just hop in, and because there's so much to it.
Yeah.
So
And
you
for people
can't,
who don't know, I just want to let you know my comprehensive DNA test was 126 pages. So if you think you can just wing it, like, get a
exactly.
professional.
Exactly. Because, and again, because the deep dive, the GI test that I do, I have traditional GI doctors look at it and are like, I have no idea. I have no idea what this is. Well, no, because I, I was educated just on that class for quite a long time. So there's so much to it, and it's a lot deeper than most people think, you
Yeah.
know.
Yeah.
So it's a
100%.
lot.
But it's absolutely my recommendation for anyone who is having a hormone imbalance, or anyone who is having autoimmune, like they've got something going on, their health isn't right, or maybe they just want to aim for optimal health and vitality because they don't want to age with disease. My
Yes.
recommendation is hit you up. It's
Thank
just
you.
I know how much going on my health journey, and all of the rabbit holes, the ditches, and all of the things along the way that I have done has just changed the trajectory of my life. I know that it's it's had a ripple effect on like me helping so many other people, but also my children. It's always
Yes.
been a health value of mine because I was raised with health, and so I want to also pass that down to my children. And I have a 20-year-old daughter who uses the same supplements because when she started on them, she was a teenager, and we'd just moved from the mining town, and the different environment was affecting her eczema. And so with the program and the nutrition support, it just went away. We weren't even expecting that. And so
Hmm.
she went off it after she moved out of home. And then she was like, Mum, need it. Called me up and got
Yes.
herself back on it because her skin was flaring up again. And so, and it was funny because her boyfriend was even like, you didn't have eczema. I didn't know you had eczema. She was like, well, that's because like I manage it. Like I didn't.
Exactly, exactly. And it starts with little steps. And I'm happy to say that, the group program, I can take people from all over the place. Just, I think out of the US, we just can't do labs. You have to get your own labs. But it's, yeah. And you don't realize, and it's when you feel oh, something's just not right. I don't feel right. That is the first sign to say, okay, let's do a deep dive, because how many years that you're told, oh, you're fine, oh, you're fine. I mean, I had a kidney issue that I was being watched for 7 years, and I was the one who fixed it. So, and I was just, we were just waiting for it to get bad enough, and it's like, okay, well, let's do something to fix it, but no one knew how to do that because there was no pill for it. So it's little baby steps. You have to start somewhere, and it seems overwhelming, but the first step, and that's why I think I'm excited for this group program, because group support, I think, is huge. Learning from other people and other people's experiences. And I selfishly say that this is a very selfish thing that I do, because my husband and I are my first patients. So I have to be like, I have to practice what I preach, right? And that keeps me healthy. So selfishly, it's a great thing.
That's what I love, that I get paid to have a health journey. I get paid to have optimal health and vitality and show other people like it's the best way. Because for me, if I was going to hire a personal trainer, would I want to hire someone who doesn't know how to manage their weight, doesn't know how to lift weights? No, it's the same thing. And that's what you need to look for if you're going to a doctor or someone to help
Yes.
you with health. Do they align with your health values? Like,
Hmm.
yeah, if they're just pushing you pills and you're not wanting to go down that route, then you probably need to look for someone else.
Exactly. And it's okay. It's
Yeah,
okay to get a second opinion and move on.
yeah, absolutely. So, do you have any other tips that you would like to share for anyone who wants to take back their power and doesn't know where to start?
Yes. Ask the questions. Knowledge is power. So get the testing, do the research, um, get some guidance. Again, I would love to have anyone. I have a free Facebook group. I'm doing a webinar. We're always doing webinars, but a free Facebook group, my Fit Formula Reset, will be having cohorts starting on a regular basis. Um, and I share lots of education. My Facebook group is Optimal You, and just take the first step and demand to feel better, and don't be afraid to take the research and the knowledge that you find out to your healthcare provider and ask them the questions. And if you don't like the answers, then you have your answer.
And make sure you tell them that you're aiming for optimal health and vitality.
Exactly. And I don't think they understand that. Most of them don't understand that.
Yeah, it's not in the training.
No, it is not. It is not. I can attest to it.
Where can we find you? Where can we find you? I will put a link in the show notes so that everybody knows they can just click on it and come on over to you.
Thank you. I am LisaMarieNP.com, or you can find me on Facebook, LisaMarieNP, or Instagram, LisaMarie the NP.
Perfect. Thank you so much for sharing all of your insights, your wisdom, and your experiences with us today. I think a lot of people are going to learn from just our journeys. I think it's really important for people to share experiences, journeys, knowledge, and just to share the light to other people. So, yeah,
Exactly.
I appreciate you.
Thank you. It was so fun.
Thank you. If this episode spoke to you, don't keep it to yourself. Your voice matters here. Drop a comment and share your biggest takeaway, because your insight could be exactly what another woman needs to hear today. If you're ready to be part of this movement of empowered, awakened women, hit that like button, subscribe, and share this with someone who needs to hear it. Every time you do, you help spread the message further, and together we create the ripple effect. Thank you for being here, for showing up, and for being part of this journey. Until next time, keep rising, keep shining, and stepping into your power.